Going to walk through 2012 and really how we got started on this journey. 2013, which was a pretty impressive year. 2014, OMG, that about says it all. And then where we are today. Cleveland Clinic is much bigger than just Cleveland. We are not just a small hospital in Cleveland. We are a $6.2 billion enterprise. We have facilities all over the world, including Abu Dhabi, Canada, Florida, Las Vegas, which I know if you're from Cleveland, you've definitely heard of us, but if you're not, there is a pretty common misconception that we're just a hospital, and we are a lot more than that. We have over 43,000 caregivers, which in our world, that's employees. All employees are caregivers at the Cleveland Clinic. And we face a really unique challenge in healthcare. We cannot create demand for our products and services. You're either sick or you're not, you need heart surgery or you don't. We can't give you a coupon and we can't offer sales on our procedures. So I think that puts us in a really unique position. How do we market? Why do we market? How do we measure that, right? When it isn't truly, we really truly don't have the ability to directly impact sales at that moment. In 2012, it's really the beginning, there was a team in place that I was not a part of, so I want to make sure that we properly credit them, and we'll get to that in a second. But at that point in time, we were really working in silos, right? We had our digital marketing team, our corporate communications and PR team, service line marketing, creative services, all working on projects individually. So if we had a story to tell, it might start with a press release in corporate communications, there might be some information about it in a brochure, or there might be something about it on our website, but it wasn't really thought about cohesively or really truly integrated in any meaningful way. We would do it sort of piecemeal and sometimes in sequential order rather than really timing it thoughtfully. So this team, Scott Leineberger was the director of digital marketing at that time. He's here in the back row, I see him. Worked with McMurray TMG to build a blog. And the goal was really to repurpose existing offline content. For many, many years, the Cleveland Clinic produced a magazine called Be Well, had some really great consumer content that never lived anywhere on the website. So they decided to launch a blog. Basic format, WordPress site, pretty simple. The Heart and Vascular Institute also had a blog going on at this time, which I'll show you in a second. So blogging wasn't new, but blogging from the enterprise point of view was new. The hope was that traffic would eventually come from search. There wasn't really a thoughtful distribution plan at that point. But the goal was to go live in April of 2012 with some content and continue to publish every day. There, that's the fantastic Beating Edge Heart and Vascular blog that was rolled up into the Health Hub launch. The content strategy that we launched with in 2012 is still the content strategy today. It's really about engaging users in daily conversation, using health, wellness, and clinical content that's unique to Cleveland Clinic. It's all original, all the time. And when I said before we can't create demand, we can't, but we can do this. We can have that conversation, and we can build relationships with people so that when they are sick, when they do need heart surgery, they think of us and they choose us. Our goal with our content marketing, again in 2012 and still today, is this. It's building that trusted brand. Locally, regionally, nationally, and globally, right? We know people love friends they can trust. They build relationships with people they can trust. We want that same type of relationship with consumers all over the world. So in 2012, when we launched the blog, obviously had some challenges, some bumps along the way. But the biggest one was really finding enough content, creating enough content, feeding the beast, as we all have heard. It was also getting support from marketing teams because the digital marketing group launched this blog and then got everybody else to sort of start to help, right? And if you're a busy marketer, the last thing you want is something else added to your plate. So a little bit of resistance, a little bit like, another thing I need to worry about. Or they kind of had the mindset of, well, just let them do it. So a little bit of a challenge there. Also getting physicians on board with this idea of a blog. Like I said, we were doing a little bit of it with the Heart and Vascular Institute, but really not broadly across the organization. A lot of politics in there. What kind of topics are you going to cover? How is this going to impact our reputation? We can't be talking about junk science on the blog. What's really credible to be worthy of a topic? We also had the challenge of physically building the website. But we overcame those things, and in our first year, the very first month, we had over 7,000 visits, to Health Hub. That's what it looked like originally, and had over 700,000 visits total in 2012. 2013, we really arrived, and I mean that literally. I actually arrived in 2013 in February, so really early on in the year. The rest of the team stayed the same. Scott's job changed a little bit because we combined a couple of departments and created multi-channel content marketing, which is basically a combination of the team that was running our clevelandclinic.org site and creative services. But still, when it came to the blog and content marketing as we defined it today, it was still that core group of 3 or 4 people. We got really sophisticated in the distribution of the content. In 2012, we started to post things on social media, and we saw that it was working. In 2013, we took it to a whole nother place. We really got thoughtful about our social media schedule, how it was going to work, using data to optimize and make some changes to that, ramped up production volume as well. We still produce 3 to 5 posts on Health Hub every day. Again, all original, using all of our doctors, and every piece of content we publish is either written by, reviewed by, or approved by a medical expert. So we can't just write willy-nilly and put it out there, right? Definitely not. And to do that, it requires that we have hundreds of posts in production on any given day. Because approving our content is not their #1 priority. They have to take care of patients first, and we know that. So most of the content that we write, it's pretty evergreen. It can be used whenever we get that approval. If something, though, has a really timeliness to it, or it's in the media and we want to push it that day, they'll work with us. We'll make that happen, but we try to be really selective about it. And we'll also look and see if we have an existing piece of content about that topic and just make the timely hook part of the social media post. So we just started to get smarter about the distribution, and we also started to work with more and more departments across the organization. So we started to use content to support some of our advertising initiatives. We started to work a little bit more closely with our PR team and maybe, sharing some of this content with media outlets. We started to consider syndication. We just really started to think, how can we get more out of every piece of content we're producing, because it's taking us a lot of resources to do this.